Make some noise.
Hi, everybody. Welcome to our first speaker of our CAT 50K training plan speaker series. I'm Sophie Spidell, and I'm representing the Charlotte Trail Runners and Crazy Running tonight. Thanks for coming out. Before I get to our speaker tonight, just a few announcements. If you are not a member of the Charlotte Trail Runners, we're in the midst of a membership drive. This is a cool sticker you can get. And they're free tonight. But go ahead, go online and become a member. Your membership dues go for really great swag at our events and help support a lot of the fun initiatives that we do as a club. So membership dues are how much? $15. So come on out and join the cats. Speaking of bucks, if you'd like to make a donation tonight for the speaker series, we are planning to have, in addition to David tonight, Wednesday of the month, March and April will be our speakers. In March, I believe that's March 8th, is Kristen Chang. She is a nutritionist from Lynchburg, married to Jordan Chang, who's actually been featured in Blue Ridge Outdoors this month, who's an ultra runner. And she is going to talk about nutrition, hydration, fueling, and everything you need to know for ultra running and trail running. She's a fantastic speaker. That's going to be at Crozet Running in March. And then April 5th, Wednesday, April 5th, Dr. David Horton will be joining us to talk about how to prepare for your first ultra at Promised Land 50K. He's very entertaining. I can't say that enough. So that'll be, mark your calendars, that'll be Wednesday, April 5th at Crozet Running. Okay? All right, so tonight, David Hryvniak is going to speak about intervention, and I guess we're going to go 45 minutes, and then maybe Q&A.
Yep, I'm happy to answer questions.
I can answer questions, and then maybe cut things off around 8-ish, 8:15, because I know we're busy out there. But we really appreciate you being here tonight. So, David Hryvniak.
Thanks for having me. Just briefly, I'll tell you a little bit about my background in a little bit. I'm one of the sports medicine docs at UVA. I work at our runners clinic with Bob Wilder and Sean Sakuda, and also local trail and road runner. They have seen me out at some of the races. Sophie asked me to come and talk a little bit about, common running injuries I'm seeing, what the causes are they, and give some information regarding warm up, cool down, things like this that you may not know training for your first ultra, and some of the literature shows us. And then I wanted to discuss some unique ultra running medicine topics, some things that are really unique that can really put you in some harm when you're running ultra, and just discuss what they are and kind of how to prevent them at the end. So how did I get here? That's me running in high school in upstate New York, and you can see how bad my form is up there. I moved out to William & Mary, where I ran cross country and track there for several years. Went to medical school at Virginia Tech, where I started getting into road racing and some trail running. And recently, I've kind of moved into the trail running and mountain running realm. So this is me running up Mount Washington. I don't know if any of you have done that race, but if you're looking for a tough climb, 7.6 miles at 11%. So I average about 9-minute pace for my whole uphill race. So it's a brutal climb, and that's at the top. It's beautiful there. So that's kind of where I'm from, and then I came here to the University of Virginia after Virginia Tech to train under Dr. Wilder because I thought there was no other place to train. We do physical medicine and rehab, which is basically non-operative orthopedics. So I do sports medicine, but I'm not a surgeon, so I try to do everything up to surgery. And then I did my fellowship here where I worked with the UVA and JMU athletes, which I still do. And then Dr. Wilder asked me to stay on as faculty, so I worked in the runners clinic with him. How could I go to Charlottesville? So, no brainer. So, I should stop running until that pain goes away, says no runner. So, we're going to talk a little bit about this mentality. Some of my most common mistakes that I see in my clinic. So, transitions. So, this is where new runners get, and runners with experience get hit. So whether that be shoes, mileage, surface, intensity, or even life changes. So, with shoes, general rule, and we'll talk a little bit more about shoes later on. I like to say replace your shoes every 400 miles. Some people, it'll be a little bit longer than that, the lightweight, efficient runners. And some people will actually wear their shoe quicker than that. And we'll talk a little bit about barefoot running as well. And I would say don't fix if it ain't broke. So if you've been in a minimalist shoe or barefoot shoe and that works well for you, then don't change it. If you've been in a little heavier trainer shoe and you're not getting injured, then no reason to change it. And we'll talk a little bit about that as well. In terms of mileage, I would say, and I looked through your guys' training program and I was really impressed because it factored in two rest days, it factored in some cross training, which we'll talk a little bit about later. And it was a gradual progression, not only in the long run, but then also with mileage. So I always recommend no more than 10% increase per week. And for ultra runners, this is difficult because you need to get the mileage and prepare for a race. But we find that if you're increasing more than 10% a week, and if the long run's really exceeding 20% of your total weekly mileage, that's when the increase starts to pop up. And then, ultra training. How do we get around this? So then I talk about time on your feet. Rarely are people going to go out and do a 40-mile training run to get ready for a 50-mile. 3 or 4 hours, and it's more about time on your feet because your body doesn't know mileage; it knows time on your feet. So that's how you can kind of get around the mileage. Go slow and just get time on your feet. Surface, I would say train what you're going to race on. So if you're going to be doing a road marathon, train on the road. If you're going to be doing an ultra, doing Western States, train on what you're going to be racing on. Increase the risk of injuries. Really, it's the transition of surfaces. So the literature shows that injuries aren't you're on a hard surface versus a soft surface. We always think, oh, you're on a soft trail, maybe that'll be better for our legs. But it actually shows that our body is really good at adapting to the surfaces. But it's really that transition when you go from doing all your running on trails and then all of a sudden jump to heavy training on the roads. It's that transition where you're at. Intensity, so you're adding in speed work. And I like how you waited a few weeks in your training program to add that in, John, so I think that's excellent. We want to gradually add in the intensity. And then life changes. This is things people don't think about. You have a kid, you buy a new house, you start a new job, you're transporting your 2 kids to soccer games all weekend. That all adds into cumulative fatigue and can put you in injuries. So I always ask these things when you come see me in the office. Another most common mistake, ignoring your body. So not listening to your body when these little things pop up and not taking days off. And I always tell people recovery is just as important as training and meeting your goals. So if you're not recovering and your body's never getting a chance to use that work and allow yourself to go to the next level and continue to improve. So recovery is extremely important with the training process. So Ryan, you're doing it wrong. So epidemiology, we see 30 million, there's 30 million runners in the US, and about 70% of all runners will sustain an injury during the year at some point. Most of what we see are knee injuries, some, a lot of shin, Achilles, hip, groin, a little bit of spine, a lot of foot and ankle. This is intrinsic to us. So, some of us have a little bit more flexibility and some of us, these are abnormalities that I look at in my clinic. Some of this is genetics and how we're built, and some of this is just lack of stretching and lack of time to work on some of these weaknesses and balance things. But some of us are just more flexible, more inherently unstable than others. And then there's extrinsic abnormalities. Training errors come into play. Equipment like shoes, environment, technique. So running gait. We're going to talk a lot about running gait tonight. That's one of my big keys on running injury prevention. And then, sports and imposed deficiencies. It's as well. So factor in the running injuries. So when you come see me, this is what I do. I do a history. I'm doing a biomechanical assessment. I'm doing a site-specific exam. So you hurt on your shin, you hurt on your knee, and I'm examining that. I'm doing an dynamic exam. So you're not a still person. You're an athlete. So I want to look at you run. I want to look at you do some squats and things like that. I want to look at your shoes, see what your wear pattern is. And then we add in some ancillary testing if needed. So when I'm looking at a history, when you're telling me about my history, your history, I want to know what are your prior injuries? What things have bothered you in the past? You know, are you on a team? Are you on a club? Are you on the Cruiser Running Ultra team? You know, that factors into goals and factors into what kind of training you're doing. Identify those transitions again. What's your miles per week? You know, is it 20? Is it 40? Has that changed recently? Long run, again, no more than 20, 30% of your weekly total. Intensity, I want to know about surface, shoes, orthotics, cross training, goals, life stressors, fatigues again. And then females, I always ask disorders, any history of menstrual irregularities. A lot of females don't have periods, and that's a problem for our bones. And we put us at increased risk of stress fracture. And then any history, either in the athlete or in the family of osteopenia, osteoporosis. So shoes. I'm not going to stand too close to this. So I can tell you, I run in a minimalist shoe. Years to transition to that. I was a traditional field running shoe, and then I worked a little bit with Mark Pizzella, who's one of my mentors, and I'll talk a little bit about him later. And I kind of gradually transitioned. I was sponsored by Newton for several years, and it kind of forced me to transition into a low drop shoe. My first run in Newton, my calves hurt for about a week because I just wasn't, the gait changes weren't there. So shoes, there's lots of good options. That's a good thing. You can get the big Hokas, you can get the ride with about 5 fingers. That's a good thing. There's a whole wide spectrum from a barefoot to a minimalist to, if you think about it, Hoka is technically a minimalist shoe. It's a zero drop. And then up to structured triax, which is a big, hefty, motion controlled shoe. Shown in the literature to affect impact forces, loading rate, and torque forces. So what does that mean? There's no literature to show that how shoes affect injury rates, unfortunately. There's not really much out there, either for big hefty shoes or for barefoot. I did a survey study in my residence simple things that you can incorporate into your form are really key at reducing the forces across our knees and our hips and our ankles, and improving our efficiency, improving our performance, as well as decreasing our injury risk. So one thing we always say is run tall. Imagine your column being stacked underneath your heads. You want to be running up tall. You know, you want, and then look forward to the horizon, and then as Mark says, Mark Pizzella, when he's giving his talks, lean gently like you're giving someone a kiss. A lot of us run like this because we sit like this all day. So a lot of us run way forward, or we run way back like we're in the back seat. What we want is just a gentle lean and then use gravity to basically pull us forward. But it's hard to run tall when we sit at a desk all day, hunched over. So here's the crack body position. We don't want you in the back seat. We don't want your head forward. We want you with a gentle lean. How about core? So our core and our glutes are extremely important, not only propelling us forward, but maintaining our stability while we run, as well as maintaining that upright posture. So we want them to be strong and stable, but also be firing properly. So a lot of us have strong glutes or strong abdominals, but we don't necessarily fire them when we run. And this really is important for optimal transfer into the ground and stability when we run. So if you look at this person, they have a weak glute, so you can see they drop their pelvis when they're running. But look at Mark when he runs. Completely neutral pelvis. He's not dropping at all. And you can imagine when you're dropping your pelvis, look at the torque that you're giving your knees and your ankles. So over time, over miles, this will all add up. So we'll talk about how we strengthen our glutes. Force impact. So this is a guy running in the back seat, and this is what Jay DeSherry calls a toilet bowl of doom, because he's landing, so he's running like this. And you see when we land, we have this big impact peak, and then like that. Whereas if we land underneath our center of mass, in line, running tall, we have no impact peak. And we think this impact peak puts a braking force and a torque force on the knees and the hips. So if we can get rid of that impact peak, that's a big one. How about your arms? What are we supposed to do with our arms? Well, your arms set your rhythm, so they're really important for setting that. So you want to keep your elbows at 90 degrees. You want your knuckles facing towards your sternum. And you want just a relaxed rearward drive of your elbow, with your arms reflexively coming forward. It shouldn't be tight. You shouldn't be forcing it. You shouldn't be crossing center. I've had runners who stretch their chest when they run. And the farther we put our arms out in front of us, it kind of causes us to overstride. It changes the mechanics and changes our center of gravity. It forces us to overstride. So we don't want our arms way out in front, because that'll cause you to overstride. How about our feet? So we want our feet underneath our center of mass. We don't want it way out in front. When we're running, and I'll show you a picture of this, a video of this later. If we're landing way out in front of our center of mass, we're basically braking ourselves every time we run. Every time we land, and mess up with your efficiency, but also increase the torque and the forces through your knees and hips and ankles. So we want the full foot to contact the ground underneath your center of mass, right underneath, or just in front. And then we want to use our legs to store and release energy. Our Achilles are built like a spring, and we want to use our Achilles to collect energy and drive us forward. We don't want to be leaving energy into the ground. So you see this person, they got that forward lean in there. They're propelling themselves forward. Whereas this person's running and they're providing a braking force. So they're not propelling themselves forward. They're actually braking themselves every time they run. So this is another video. So this is at the Boston Marathon in 2010. This is the 3-hour marathon group. So watch these guys. They're running and they're just providing a nice braking force. And look at what that's doing to their lower legs and knees while they're running. And then wait for it. Here comes the barefoot guy running to Boston. Look at that form. I mean, braking force. So it's pretty cool, and they're able to slow this down and kind of look at how are these folks loading their feet at this point. I think this was mile 17 of Boston. Look at that. So, you know, not only from an injury risk, but how much are you slowing yourself down by braking every step? I mean, we take we take how many steps in a race. So let's watch the elites and see what they run like. Slow-mo. So this is also in Boston, 2010. They're in shoes. They're running like the barefoot guy. Underneath their center of mass, and they're propelling themselves forward. They're not providing that big braking force that we saw in the 3-hour group. Med is a little bit, but we can blame that on the Skechers. So I think it's interesting to be able to compare those. It's me. So you see that these elites, they're landing underneath their center of mass, and that force is going up through their pelvis, up through their spine, directed upwards, and then they push off rather than being directed backwards and causing braking force through their knees and their hips. Cadence. So cadence is really important. When people try to run faster, they always think they have to increase their stride, but your stride should stay pretty constant throughout different speeds. What we should do is increase our cadence. So my goal cadence is 170 to 180. That's the really goal cadence. And what are we doing? We're harnessing the energy from the springs, the Achilles, and we're extending our hips and propel us forward. But what we find is if you increase your cadence, it's really hard to overstride and land way out in front of you because you just don't have time to do it. So when I have someone who just kind of has that slow plodding gait and they're landing way out in front of them, I try to speed up their cadence and it automatically kind of shifts their foot more underneath their center of mass. So a good way to practice this is, a lot of the watches have this actually now that you can look at your cadence, but metronome app on your iPhone and just set it at 160 or 170. Count yourself in a run first and see where you're at, and then set it at 170 and see what that feels like, and then slowly introduce that. Remember, transitions, we want to increase this too quickly. Try to get your way up to that 170, 180 in a minute, and that's for both legs. So 90 on each side or 180 for both legs. A lot about all that stuff. What can we do about this? So Sophie asked me to give some key exercises that I think are most important and easy to do, because I know we're all busy people, and finding 30, 40 an hour of time is really difficult to do in addition to running. And these are things that you can do at home in front of your TV that really help. You know, I'm a big fan of just standard old bridges, so that's up here at the top. And what am I doing here? You're just tightening those glutes and pointing up towards the ceiling. And as that gets easier, you can add in a leg lift, or, you know, she's doing very running specific leg lift. And what you want to do is keep your pelvis neutral during this. You don't want to be sagging from one side to the other. And you hold it for a minute or so, and then you take a rest, and then you do it again. Planks, this is great for our transverse abdominis, which is one of the key muscles that are really weak in people that help maintain our stability and our core stability especially. So planks are easy to do, and then as they get easier, you can just do it one arm. But this is something that you just hold for 45 seconds, a minute, and you're really engaging that core and teaching it to activate. And then as that gets easier, you can add in a marching technique or a running technique to that. And what are you doing? You're teaching your body to activate these while you do a running specific thing. Here are some more things. So if you have a band at home, which most of us do, then you can start adding these in. So these are called clamshells at the top. I love this exercise. You basically you bend your knees and hips to 90 degrees, and you're basically bringing those legs apart. And this really isolates that glute medius, which is really important in maintaining pelvic stability. So this is really a great exercise and something you can do at home. You can start doing some of these where you're basically extending the legs and working on not using your hamstrings, but using your glutes to help extend your legs and teaching that. Side stepping, where you're really activating those glutes again, that glute medius, and you're basically stepping and using a little bit of resistance while doing that. These are horse kicks or something like that. I can't remember the name of the exercise, but you're basically extending at the hip, and you're practicing extending at the hip. Most of us don't extend when we run. Sorry. Most of us don't extend when we run. If I watch people run on the treadmill, they land here, and then they come through, and then they're through. Whereas when you watch the Africans, if you go back to the main picture, how are they increasing their stride? Not in front of them, but way behind them. This is how they're extending. They're extending behind them. They're using their glutes to extend back behind them. So that's important, but a lot of us don't have the glute strength. We don't activate our glutes. So we don't know how to do that when we're running because we can't even do it stationary. Some people ask me, should I add squats in? And I go, squats are great, but I want you to make sure that you're doing them correctly before you're doing weight on your back. So this is how you should do a squat. You basically, and this is how to start practicing. Practice sitting down in a chair while keeping your knees over your feet. So you don't want to be going way in front. You want to be keeping your knees. You want to be able to still see your tiptoes, and then you want to sit back in the chair. So you gotta have some trust that someone's not gonna pull the chair out from under you. But basically, what you want to do is sit back, and that's how you should be doing a squat because you're activating those glutes again. You're not using these other muscles. So that's how you should be doing a squat. And then, if that gets easy, then you can add in a little bit of weight. But be able to do this first. As you get more advanced, so this is Galen Rupp, Olympic silver medalist in the marathon this year, and Mo Farah, Olympic gold medalist times 100. So two very elite runners, and you can see they're starting to add in weight, but they're also doing very running-specific exercises. So Galen is coming up on his toes, and he's doing a running-specific one-legged squat, but then also driving up. So he's practicing that drive phase in running weight, and this is very specific. So people always go into the gym and bench press, but it's that specific running method. This is very specific to the glutes, to the stability of your running form. And then here's Mo doing, basically he's standing on an uneven board, and this guy's throwing a heavy medicine ball, and he's trying to stay balanced. And you know, I would recommend before you get on one of these, you do it just standing. So can you maintain the stability on flat ground without holding on to anything? And then can you grab a ball if someone's throwing you and still maintain that stability? And then you can add in that. But you know, these guys are professionals. This is what they do all day. So they take a nap and they go work out, lift, and they take another nap and they sit in the cold tub. And then here's some other running specific things that the Nike Oregon Project does. So the hot salsa, the mountain climbers, these runner pulls. And you see they're all very running specific movements. They're not doing movements that aren't going to help them get faster. So they're adding a little bit of weight, but they're making sure that they're doing a running specific movement. And it also helps them focus on their form as well. Advance. You can do box jumps. So this is teaching you to store that energy and that Achilles and then release it and send yourself forward instead of landing. And then, you know, another good thing about this is you can also teach yourself to land softly. So a lot of us land hard when we run. And this, as you jump off the box, you can practice landing softly. Try to be quiet while you do that. And this thing is a 4-square drill, where you're basically hopping from one to the other, maintaining stability while you do that. I think this is Mark Gazelle. This is one thing that he loves to do. He puts a tether or a jump rope or something around you, and he has you run in place, and he holds you with a tether. And what he wants you to do is practice that forward lean and practice driving off the ground, and he's going to hold you. So that's a specific kind of strength form drill. So we talked a little bit about toe yoga. I'm going to embarrass her here because she's not here. Nicole Keller, who some of you may know, she's one of our residents. This is her feed. She was in running time. And she did a piece on, are you ready to run minimalist? And if for any of you who are thinking about going minimalist or have recently, it's a great article to read by Janine Sherry and Eric Magrum, who's a therapist in town, and Nicole was nice enough to volunteer. But basically, it goes over some of these strength-specific things that you need to be able to do, flexibility-wise, in order to make sure that you're not putting yourself at increased risk. So this is that toe yoga. So I showed you the one where they're driving that FHP into the ground. Well, this is even harder. What you got to do is keep the other forearm on the ground and lift up the big toe. So this, again, isolates another muscle that's important for minimalist running. So what I recommend to people who want to do this is toe yoga. So just like you would for any other exercise, you practice driving that big toe on the ground, lift up the other four, and then vice versa. Lower the other four, lift up that big what you're going to find is over time it gets easier. You activate, your brain starts sending stimulus. A lot of us just don't know how to activate those muscles. We've never done it before. But as we do it more, it's going to get easier, and it's going to get easier. And then just general foot and ankle strengthening. So using the band to strengthen our ankle complex. So especially for trail runners, this is going to be key because this is going to help it prevent ankle sprains. So using a little bit of band and then using your ankle going out and then going in and then pushing down and pulling up. Doing toe crunches. So put a towel on the ground and then scrunch it up with your feet. Scrunch it up with your feet. And what is that doing? It's strengthening those foot intrinsics, those tiny little muscles in our feet that we never use, that we're trying to strengthen. Doing heel raises are important for strengthening those the calf muscles. And then picking up marbles. So being able to pick up the marbles with your feet and drop them in the cup. That really taxes the intrinsic muscles and can be really helpful. Heel cord flexibility. So, I always recommend if you don't own a pad board, buy one because I stay on my pad board all the time. And it's easy. You can watch TV and stretch your pecs at the same time. But this is another way of doing it. You're stretching with your legs straight and then your leg bent. And what that does is it stretches the two different calf muscles. One's your gastroc, which is when your leg's straight, and then when you bend your knee, it stretches the sole of it. So we really want to work on that. Folks who are having a little bit of plantar fascia issues, get in there and massage, stretch out. You see, he's pulling that big toe back and really get a good stretch, and then he's massaging right in there. And what we want is we want you to be flexible in your ankles because it's not only going to prevent injuries down there, but it's also going to affect the whole kinetic chain up the leg. So you can see Nicole here again. She's got good flexibility in that ankle. Foam rolling. How many people do foam rolling? It's a cheap man's way of massage. So if you don't own one, get one. It can be really helpful, especially for IT band issues. Just breaking up some of that chronic scar tissue and help getting on top of things before they start becoming a problem. Stretching your IT band. This is one stretch that I think every runner should be doing. So we all sit all day and our hip flexors get really tight. You know how when you go for a 12-hour trip in the car and you get out, and it's just really tight. That's a hip flexor. So they're a big honking muscle with a big tendon. And they get tight because we're a sitting society. And guess what? When we want to run and we want to extend at our hips, those hip flexor muscles are restricting that motion if they're tight. So this is a good stretch. You basically want to keep yourself neutral in terms of your spine, and then you want to be feeling a stretch across your groin while you do that. And hold it for 30 seconds, 45 seconds. And do this every night because this is going to help you increase that range of motion and allow you to use those glutes. So Sophie asked me to talk a little bit about warm-up. How do I warm up before a race or a workout? This is what I typically do. So you go out for a 10, 15-minute walk, jog. It depends. If you're going to be doing 50K, you may not want to go out and run 15 minutes because you're using energy. So you may want to just go out and walk a little bit. And a dynamic warm-up. So this is not only for warming up the muscles, but it's also helping encourage some of these form changes that we're trying to do. So I'm not sure who this guy is, but he's trying to show some form drills here. So this is for a runner clinic I did for Mark's marathon training group, Mark Jones. And what I'm showing is A skips, B skips, and then I'll show C skips, and then karaoke. And these are just simple form drills that I like to incorporate in my warm-up routine that don't take that long and really teach us to not only activate our glutes, help work on our cadence, and help teach some of these form things we're trying to incorporate into our routine. So, landing under our center of mass and not landing way out front. So these videos are up on the Charlottesville Track website, and I have more in-depth videos for each drill, and then I'll show you some pictures here. So simple A skips, basically you're just coming up and you're landing underneath you. And what are you teaching yourself to do? Land underneath you, not landing from here. So I do a little bit of skip, and that's what I do. B skips, so you're teaching yourself to extend at the knee and then land underneath. This is a B skip, so you're skipping. C skips, which is kind of like butt kicks, as you may remember from high school running if you did this. So basically what you're trying to do is teach yourself to get your feet up off the ground quick. So this is a good time, not so much to get all the way up and kick your butt. I don't think that's as important. but teaching your body to pick up your feet off the ground. Don't stay on the ground too long. You don't see many of these leads running like this. I mean, you see them go like this. So teach yourself to rebound off the ground. Use your Achilles to act as a spring. Mark encourages jump rope. So run while you jump rope. It's really difficult to do, but you teach yourself to not land way out in front because you can't do that. You'll hit the jump rope. So if you land right underneath you, you're going to avoid the jump rope, and it's a good way of adding in some of these drills. So you don't have to do all of these, but there are simple things that help activate our glutes, warm us up before we go and do an effort. So I like doing these before speed workouts, before uphill runs, because I want to activate those glutes, or before races. So how about cool down? So recovery. So first of all, when we hit the finish line, don't stop moving. Everyone wants to sit down, stop. Don't stop. The first 15 to 20 minutes moving around, slight jog or walk to help your body. Use those muscles to pump all that lactic acid and all that junk in your legs and get it out of there. And it's going to help you recover over the next week or two. So especially if it's a workout and you're trying to recover to get ready for a long run on the weekend, you want to make sure you're cooling down and walking after. It doesn't have to be really fast. It doesn't have to be really long. We're getting out for a 10 to 15 minute jog or a walk after. Post-race massage. So if you have availability after a marathon, use it. It's free. It's a great thing because it can help, again, mobilize some of those toxins and get you feeling better. But if you don't have that, which a lot of ultras don't, then add in the foam roller. Have that in your car and hop on the foam roller after. Hop on the foam roller that night after your workout. Really help mobilize some of those tissues. Another important thing that we always forget about, eat and drink. So I always bring some kind of food and some kind of drink with me, whether it be a can of Coke or a Gatorade or after my run, and then a Nutri-Grain bar or something. Because the literature shows the first 24 minutes after you finish an activity is really the ideal window when your body's going to absorb those nutrients and allow you to recover the best. Once you're out of that window, you're just not going to absorb those nutrients as well, and you're not going to form that glycogen. So the ideal ratio is 3 to 1 in terms of carbs to protein. And guess what? We have something that already kind of meets that ratio that it's easy and delicious to drink. The chocolate milk is a good recovery drink. But there's a lot of different things out there. Just eating and drinking something is better than doing nothing. Rehydrate, especially after hot races. It's common to lose a couple pounds after hot races. You want to replace that weight with water and electrolyte drinks. Compression socks. So compression socks, a lot of people wearing the racing. There's no evidence to show it improves your ability to run faster, even though Paul Radcliffe set the world record in the marathon. But there is some evidence to show it improves recovery. So wearing them when you recover after a race or after a workout can be helpful. Ice baths, whether it be a stream next to the finish or like this guy here. It's been shown to help with recovery. Sleep's important. I know better than most. Not getting 7 to 8 hours because you're up with your kid or you stay up watching Netflix. You're going to pay for it when you go to your 50K training. So what you really want to be doing is getting 7 to 8 minimum. And really, you should be getting more if you're putting in heavy mileage. And then mental recovery. So this is more important after you finish your 50K. Take time, spend with your family, mentally recover. Everyone always wants to look to the next race or start training right away. Your body takes several weeks to recover after a marathon or an ultra. So make sure you're mentally recovered. Get excited to run again. Give yourself a chance to do some of the activities or spend some time with people who you haven't been able to see because you've been training. So if you ask me, when should I go see the doc? So, okay, I feel something coming on. So these are our relative activity modification guidelines. This is what myself or Dr. Raleigh will tell you in terms of, is it safe to run on this? So as long as it's mild pain, 1, 2, or 3 out of 10, that's a good thing. We don't want it getting up to 6 or 7. Pain that goes away with running is usually a good sign. Pain that gets worse throughout a run is not a good sign. And then the biggest thing is no limit or change in weight. What we don't want you doing is getting a mile 3, a mile 4, or 5 mile run and limping, because that means you're doing too much. When should I see the doc? When you start having pain at rest or pain with your daily activity, like the college kids I see, when they're having pain walking to class, that's not normal. Pain at night when they're laying there, they feel the shit they feel. Pain with non-running daily, it's persistent pain. Pains that's going on for weeks. We're all going to have aches and pains pop up from here or there. But what we don't want is this to persist for weeks or months before we get it checked active sciatica. So for those who don't know what sciatica is, it's where that sciatic nerve gets pinched and it causes active numbness, tingling, weakness down the leg. That's not something you should be running on. And then if your knee's obviously swollen compared to the other side, don't run on that. That's your body telling you, okay, you've done something. Maybe you should get it checked out. But otherwise, we don't want you running on stress fractures. We don't want you running on sciatica. But for the most part, if you can stay within these guidelines, the likelihood that you're doing harm is pretty low. So cross training. So I run 6 days a week. I don't run 7 days a week anymore. I just can't do it. I don't recover well. I don't feel good. I'm grumpy to my wife. It's just not a good situation. So I get out and I pool run. You can hop on the bike. You get a elliptical. If you don't like being on the elliptical, you might get out and see the country. You hike, swim, pool run. Pool running has been shown to, you can basically get the same aerobic effects in the same amount of time if you get your heart rate up to the same level. And it can be really easy on the joint. So I'm a big proponent of pool running. But just in general, any of these things, it's weak, it's great, but if you can really get a different activity and use some different muscles, you're going to be an overall healthier person and a better athlete. And allow yourself to recover and reap the benefits of your training. So I'm not going to run myself into a knee replacement. I just thought I'd touch on this because I get this question a lot. Studies are kind of mixed. So there's human and animal studies. We do know that running affects the mechanical and composition of cartilage. Moderate volume running seems beneficial. High volume running seems to do some damage, but I'm not quite sure, and that's just in animal models. There's strong evidence that if you've had an injury to that joint, if you're heavier, if you do a heavy manual labor job, then you're at risk for osteoarthritis. But there's really no existing literature to show that low or moderate volume running increases our risk of osteoarthritis. And it's really inconclusive regarding high volume running and osteoarthritis. There's some elite runners who get it and some who don't. And running pace may be a significant variable. So you may see that running faster puts you a little bit increased risk than running slower. So that's where we're at right now. It's not a great answer, but there's not any literature to show. So that's why we're big proponents of not telling anyone that it's stop running just because it hurts. There's no evidence to show that it's going to solve anything. You're running hard rock 100 and you're up on top of the mountain and you see this and you're like, crap, what do I do? So I just wanted to talk a little bit about unique ultramarathon concerns. So weather, heat is one of the biggest ones there. We deal with cold, lightning, things to prepare for. And just, unfortunately with lightning, you can't really prepare for it, but you got to know that it's a risk and you got to know what to do. The same with cold, if you're going to be running hard rock or something where you're getting a lot of altitude change, you're going to be up in the mountains, way far away from an aid station, make sure you're carrying enough food or drink with you for a short amount of time. Make sure that you have maybe a light layer that you can throw on in case things change suddenly, which they're known to do. So I wanted to talk a little bit about heat illness because it's one of the biggest things we see at the races we cover, and it can kill you. So different types of heat illness from sunburn all the way down to heat stroke, and it's really a continuum. So it can go from heat cramps to heat stroke if we don't treat the person. Risk factors, biggest thing we see is lack of acclimatization. So it takes 10 to 14 days to get used to the heat. So if you're going to be running a hot race, you need to either be running inside on the treadmill with the heat blasted up or getting out and really practicing running in that heat. We acclimatize. We lower our core body temperature. When we start to sweat, we increase our heat loss via radiation and convection using the skin blood flow, our plasma in our blood. And, we decrease our heart rate. There's other physiological changes. Elderly are at increased risk. Children, because they have a high ratio of body surface area to weight. Recent bout of heat illness. So when you get heat stroke, for the next month or so, you're at increased risk of having heat stroke again. So that's something to think about. Fever. So even if you take ibuprofen before and it goes away, you've still been sick all week, maybe it's not the best idea to race. If you're overweight, sustained exercise, which is any ultra hot, humid marathon weather, and then certain medications. So caffeine, a lot of our athletes are on ADHD medications, and that increases the risk. Antidepressants, alcohol. So maybe drink after the race, not before. And prevention. So education, acclimatization, avoiding the extremes. And there's certain races that'll cancel once you're up into a certain heat index, like fitting clothing and fluid replacement. And we're always ready at the races with methods of cooling. So we do ice towels, ice bags, and ice water immersion. So we have a tub. And really, for someone with heat stroke, this is the only way to save their life, is getting in ice water right away. Sometimes you're in situations where this is not the case. So I always tell people, if you're out somewhere and someone's, and we'll talk about the symptoms of heat stroke real quick, someone's acting differently and you think they may have heat stroke, you want to cool them down. Whether that means get them out of the sun, dump water on them, put ice bags on them, whatever you have. Get them in the stream. So mild heat illness looks like heat cramps and spasm, tightness. We've all had this. You feel a little lightheaded. Rest, cooling. Take a little oral glucose electrolyte supplement. Get out of the sun. Elevate your legs and pelvis. We do pretty good at this. When it starts getting the heat exhaustion, then we start getting a headache, weakness, feeling a little nauseous. We increase our sweating, our blood pressure drops, heart rate increases. You can still deal with it with resting and cooling them down, and maybe eat some IV fluids if there's medical doctor. Heat stroke. So this is when they start acting funky. So people that are talking out of their heads, they're confused, they're ataxic, meaning they're just not standing up straight. That's heat stroke until proven otherwise. So these people have a temperature, a rectal temperature or an inside temperature of over 104 degrees, and they're having changes to their organs. So this is where we got to cool them down, give them fluids, and take them to the hospital. This is not always an option at some ultras, but it's good to know about this stuff so you can help your fellow ultra folks out if you see this or if you're concerned about this. Hyponatremia is another thing to worry about, especially with people who are out there for 10 to 20 hours, which someone running 100 mile or even 50 mile could be at risk for. So this is when our sodium levels drop below normal, and it presents very similar to heat illness. So headache, fatigue, nausea, mental status changes, vomiting. But the key is they're often, the pulse is often normal and the blood pressure is often normal. So, you may not be able to tell that in the field, but, this is common in novice marathon runners. Why? Because they hit every 8 stop and they take water at every 8 stop for 6 hours. They're just diluting out their salt. And what happens when we deload our salt? Our brain can swell and we can have seizures, respiratory distress, death. So very serious thing that we take very seriously. So just something to be aware of, and this is why it's important to be making sure you mix at your aid stations. You want to be taking glucose with some electrolytes, taking those electrolyte tabs. I bought salt tabs from the pharmacy, and I take those during my marathons and ultras because they help with my cramps, as well as they keep me out of the. So briefly about fluid replacement, because I know you're going to do nutrition talk. Less than an hour to go before a race, less than an hour activity, you want to do water. If you're going for longer than an hour for a run or bike or whatever, you want to be adding in some kind of sports drink. And sports drink is 4 to 8% glucose, sucrose, complex polymers. And fructose is not something that's good because that can delay your gastric emptying. So we don't want you drinking fruit juices. It's actually better to drink some of the stuff like Gatorade. And it's been shown that it's really ideal to have it cold, which makes sense. So how about before exercise? You want to make sure that you're pre-hydrating, 1.5 cups 4 hours before, 2 hours before you want a cup, 10 to 15 minutes before you want another cup. What we don't want you doing is hyperhydrating and putting yourself at risk for hyponatremia. So typically we lose about 2% body weight during a race, an event, and we want to prevent that as best as we can. So this is difficult because we have to basically individualize it to someone's sweat rate, which they do at that cool Gatorade lab, but we don't all have access like that, like Camp Newton or something like that. So a cup every 20 to 40 minutes is usually standard for most folks, and this should be a Gatorade or something with electrolytes in it. But if you're a heavy sweater, maybe you're doing a cup and a half or something like that. And then how about after exercise? So this is from the Western states, and as some of you may know, they weigh you at all these different aid stations, and what are they looking for? They want to make sure that you're not dropping too much weight or gaining too much weight. They don't want you putting on too much fluid or losing too much fluid. So common to lose up to a few pounds after a hard exercise in the heat, so we want to correct that weight loss with hydration. How about other course hazards? Altitude. So being prepared for that, training for that, knowing that that's going to be part of your your race, river crossings. This is Western States, John. I hope you're ready for it. Wildlife. What if you encounter a rattlesnake? What are you going to do? What if you get bit by a rattlesnake and you're out in the middle of nowhere? Just preparing for this, asking questions at the pre-race meetings. What happens if this happens? I know we don't always think about this, but it's important to just at least have a plan in the back of your head. And then isolation. What if you're out in the middle of the mountains and a thunderstorm crops up? What are you going to do about it? So, because 22.62 is persistence in real sports, you go into your organs start shutting down. So the reason I put that up there is because rhabdomyolysis. So some of you may have heard about this. It's a unique concern. We see it a lot in ultra runners. And basically, it's what happens is our muscles, especially with eccentric exercise, so running downhill, it damages the muscles and we release our toxins into the bloodstream. And then if they get high enough, they can cause kidney failure. And what are some of the warning signs? Coca-Cola colored urine. So during a race, your urine shouldn't look like this. That's a concerning sign. Decreased urine output. Now, I've certainly been in races where I haven't had to go as much, but if you're in a 10-hour race and you haven't gone once, that's a little concerning. Back or flank pain, that's where your kidneys lie. We don't want that. And then severe muscle aches, really bad muscle aches, more than usual muscle aches. That is a little concerning if those muscles are breaking down. Risk factors, same as heat, excessive heat, hydration, drug use, NSAID use. Please do not take ibuprofen before you go race. It'll put you at increased risk of this. It can put you at increased risk for a lot of things. So don't do it. Hyponatremia can put you under training. So someone who missed a lot of training leading up to their 50K, but they're like, I still want to do it because I paid all the money and I'm ready and my friends are doing it. That puts you at increased risk because you haven't prepared those muscles for that. You haven't done the pounding necessary. So like John, we were talking about Western States, there's a lot of downhills in that. He's going to go out and do some preparatory stuff for the downhills to prepare his muscles for that. Eccentric training. Maybe even a younger, faster male runner pushing through the pain. I'm tough, I can do it. That's someone who might end up in the medical center. So prevention. Avoid taking Advil, Motrin, Aleve, Celebrex during or before an ultra race. Don't race if you've been sick that week. I mean, it's a no-brainer. Don't over or underhydrate. Train properly. If you get injured, only race if you regain that fitness. And then listen to your body. If you see those warning signs, seek medical attention immediately. So, a lot of doom and gloom, but this is kind of inspiring for you all. So you don't really know how far you can go until you do it. So, so we have a runners clinic at UVA. Like I said, myself, Dr. Waller, and Dr. Saputa do it. We treat a whole host of different things. And our goal is to keep you running. That's our goal. We don't like telling people we're all runners there. We don't like telling people they can't run. So we try to figure out a way we can get you. We work a lot of the local races, including high school, college, and a lot of road races. So they may see us out into that stuff. Hill, thank you. Questions? I know I went over a lot. Hopefully it hit some of the stuff you guys were interested in. Questions for anyone? And I'm happy to take personal questions too at the end if you want to stay in front of the big group.
I had a question on kind of what you touched, like ibuprofen. I mean, right? We know it's best to not take it if you don't have to. And I was wondering, like, does it ever actually heal anything? Like if let's say I had an ankle sprain or Achilles issue and I took it and it felt better, but does that heal, or is it possible that prolongs healing because it's decreasing our body's job?
So it depends if you're using it as an analgesic, which is pain control, or as an anti-inflammatory. And really where that comes into is dose. So when I have someone take ibuprofen, I have them take 3 or 4 tablets 3 times a day, every day for 2 weeks. So I do it every day, no matter if it's hurting me or not. And what I'm trying to do is shrink out the inflammation and the swelling in that area. Now, when you take 1 or 2 here and there, then you're really just masking the pain and you're not using a whole lot of inflammatory ones. So when you come see me, I may start you on an anti-inflammatory, but it's not to mask the pain, it's to decrease the inflammation. It's for a short term, 2-3 weeks max. I don't like keeping people on this long term. But, sometimes having an ibuprofen to get you through a little nick that you know is not serious is okay. It's just when you become a regular, I have to take my 3 ibuprofen or I can't get out the door. Then what are you doing to yourself?
There's a question back here.
Art.
In the osteoarthritis article, how do they quantify
mild or moderate level? Who knows the answer to this question? So in the animal studies, they actually had rats, and they had them run on the wheel, and they had them run up to, I think it was like 25 kilometers, which for a rat, compare that to human miles, that's like 1,000 kilometers. So can you imagine the 25 kilometers on that little wheel? So yeah, that's how they got the rats to do high mileage. Obviously, my residents know that. Other questions? Yes, sir.
So what's the general thought on stretching before or after the race? I know you're talking about you're stretching out your calves and whatnot on watching TV. If you're going to start a long run, stretch before, stretch after, stretch before.
So I always tell people you don't want to stretch a cold muscle. So it kind of depends on what your warm-up routine is. You know, if you're going to do a short 10-minute jog and then do some drills, then your muscles are warmed up, then it's okay to stretch. I usually stretch after a run, actually. I just find it's easier to fit that time in, and my muscles are warmed up, and I'm not going to stretch a cold muscle. What we don't want is you stretching a cold muscle. So if you wake up first thing in the morning and then you do all your stretches, you're stretching already taut cold muscles. So what we want to do is add in a little bit of heat, a little bit of warm-up. That's what I would encourage. So doing a little bit to get you out the door would probably be fine, but to do a full stretching routine before you go out for a run, unless you're doing a little bit of a warm-up, even if it's just a short walk, and then doing a little bit of having the muscles warm.
Talk about the stride. And I know my cadence is very regular. Sense that my stride changes dramatically from when I'm just jogging, racing, or other. Should I work on making that stride consistent
And your cadence will stay pretty similar, or at least it should, but it naturally goes up when you're running faster. But your stride will increase some as you run faster. It's just a natural thing. But what I don't want you doing is increasing in front of you rather than behind you. So, you know, increasing in front of you, you're going to be landing way out in front of your center of mass. And people think when they run faster, I need to get way out in front of me and increase that stride. And that's really what we shouldn't be doing. So, you know, you're naturally going to increase your stride some, especially, say, you know, you're going to have a short stride when you're running uphill, and then when you're downhill, just gravity is going to pull you with a longer stride. But, you know, in terms of running faster, you're always going to have a little bit longer stride. You know, it's something you can work on, but I always encourage people to practice standing behind them rather than out in front of them. Yes?
That triggers a question. Running downhill.
Yes?
So your natural tendency would be to brake. Good or bad? And how does someone keep that from happening naturally to their death?
So it's hard. I mean, it's hard. I mean, that's what our body wants to do. It's the mechanics of running downhill. You want to kind of break yourself. But if you watch the best hill runners and trail races or ultras, they're not landing and braking. They're landing on their midfoot, and they're accelerating on it downhill. I try running with Mike DeBova or Neil Gorman, some of these guys who are just fearless, and they're accelerating on the downhill because, you know, what I try to think of is almost doing the butt kicks exercise. Instead of landing way out in front of me, I try to increase my cadence and go faster. And that way I'm not landing out in front of me. So, you know, I try to increase my cadence while I'm going downhill. But on a trail, it certainly takes some guts to do that because, you know, the braking feels nice and you feel more stable. And when you increase your cadence, you're at more risk of falling or something like that. But not only is it going to slow you down, but think about each stride, you're putting 2.5 times your body weight through that leg, and you're braking hard, and you're putting a lot of stress to those knees and hips. So, you know, a really long hill race that can play a part, as well as into your muscles. You know, like we talked about with rhabdomyolysis, if you're landing hard, you're really possibly tearing up those muscles. Hopefully that answered your question.
That specific question that I was a little confused about. These sits for your, like the wall sits where you use the chair. Are you coming down and just keeping your butt right off the chair? I didn't understand that exercise.
I mean, you could certainly just practice sitting down at first and practice that way, and then, yeah, as you get stronger, you can just hover right above the chair, and then you can get rid of the chair. Yes?
You mentioned that as a sign of injuries, it's okay, or it's actually a good sign. Which incidents where, as I was running, it was I shouldn't have been running perhaps, but I did. And then we go away as I was running, and afterwards we come back and I feel more sore.
Sure.
Could you explore that a little bit?
So, I mean, it's not always a good sign that pain goes away if you're running. And, you know, that kind of goes into the rules of it's painful with non-running activities, walking around, things like that. That's a bigger warning sign to me than, but, you know, in general, you know, a lot of people feel like their plantar fascia will be tight at first and then it'll kind of warm up throughout a run. And you know, I tell them the likelihood of it being causing damage is pretty low because really it'd be more painful if you're doing damage to it. So you got me there. I mean, it certainly is not always the best case, but you know, there's certain injuries that will feel good during a run and then hurt after, but it's really that hurt after that I'm that's going to be a red flag. You know, I think those rules trump the other ones. If you're having pain at rest or pain just walking around, if you're having pain at night, those are signs that, you know, something bad's going on. And, you know, it kind of trumps those MIA. Yes.
So I definitely am very much a quad runner. And I saw some of those stretches and can understand the hip flexor things and the strengthening, but is there any other tips on how do you transition that to really make sure that you're utilizing your glutes and using that power?
It's hard. It's definitely hard. So there's some gait cues that we can give you. One of the biggest things is increasing your cadence. You can't land out in front of you if you're increasing your cadence. It's just really difficult to do. So practice slowly, increasing your cadence. That's one of the best ways to really shift our legs underneath our center of mass. And then some of those drills, you know, practicing landing underneath you, you know, practicing that is slowly going to add in some motor learning to your gait, and you're going to notice some changes. So, you know, those are usually my best suggestions in terms of adding that stuff in. And then sometimes shoes can help. So I found the Newtons to be really helpful for my transition. I used to have horrible heel striking gait, and then I kind of transitioned it into a minimalist shoe. And I told you I was really sore at first because I wasn't ready for it. But it also helped me make the transition. And now I run in whatever shoe I want, but I keep the same form. So if I run in a big heel shoe, I'm still landing mid-foot. But you know, sometimes those shoes can be helpful. So I always tell people, if you're going to try a barefoot shoe, or if you want to try barefoot running, start with just doing some of these drills barefoot, or start with doing some light jogging around, you know, a field where you know you're not going to cut yourself on some glass after a run in shoes, and practice some of these things. And then, you know, you're slowly going to integrate this into your motor learning.
Question here.
Yes.
So along this sort of mild injury line, you know, what are the things, I wonder is, you know, so in terms of resources for data analysis or things like that, where you're not fully injured, but you're definitely borderline, you know, should we come to you as a doctor, or are there other resources that are, you know, not full to sort of get that sort of analysis and help?
Sure.
Yeah, thoughts on that?
So yeah, we have a treadmill, and we do some gait analysis in our office. So if you come see us, or even if you're just coming in for an injury, I like to throw people on the treadmill and look at their gait, see if there's anything I can tweak in terms of that stuff. A lot of our therapists do that, so they all have treadmills in their offices, and I will add that into my therapy prescription, give them certain things that I'm seeing in the office to work on in terms of cueing. So quad dominant gait, slow cadence, you know, a lot of vertical displacement, which means you're going up and down instead of forward, and you're wasting energy that way. You know, and those are things that the therapist can do. And then at UVA, we actually have something called the Speed Clinic, who some of you may have heard of. It's one of only 2 treadmills in the world. Us in the U.S. Army have one, and it's a treadmill that has 3D cameras and force plates on it. And we do a lot of research on it, but we also do private gait analysis for people. And basically, our head of our lab, Max, will spend 3 to 4 hours with you, and he'll do some functional evals, get you on the treadmill, and then he'll teach you how we fix that. And that could be really helpful. And I think it's pretty reasonable. It's, you know, a couple $100. You know, insurance doesn't pay for it, but for someone who's been battling gait, or just someone who's curious, it's kind of a cool Christmas present. I know people get that for Christmas. Go get your gait out and analyze. So it's a really unique resource that we have in the community that a lot of people don't know about. And we send our folks over there sometimes, or you can just give them a call, and it's called the Speed Clinic. Other questions? Yes.
So when can you run with plantar fasciitis and when should you stop?
So, I mean, I think it goes back to those rules. I mean, how much pain are you having while you're running, and how much pain are you having after? If you're having some stiffness, the most common thing I see with plantar fasciitis is people feel miserable the first few steps in the morning, and then once they kind of get up and move around, they're feeling good. What I don't want is that progressively getting worse throughout the day, or you're feeling good and then you go for a run and then it's really bad. Those are reasons probably to back off either in intensity, volume, or to stop running altogether. But I think if you could stay within those guidelines, usually the likelihood that you're doing more damage to that plantar fascia is pretty low.
Okay, I'm gonna just give opportunity for you to come up and talk to David individually, but let's give him a hand for.
My card and a little brochure pamphlet kind of about what we do at the Runners Clinic. If any of you are interested, grab one on your way out.
Okay. And I've neglected to mention, David cleaned up and won the summer series, 2 years in a row?
All of them.
All of them. So this guy knows how to run a hill pretty fast and knows his stuff. So thank you so much for spending the evening with us. And thanks to everyone for coming out. And we'll see you Saturday or at our next speaker. Okay, great, thanks. Safe travels home.
Thanks for coming.
We have a little capsule for you.
Oh, thank you. That's great.
It's a small size. I just looked up the sizes.
Yeah, I think that'll work.
Yeah. I can also give you another size.
No, if it's like a technical shirt, it's all really fun. Awesome, thanks. I appreciate it. Hopefully that YouTube video.
I wonder how that turned out.